I'm Dr. David Hayes Bautista. I'm a Distinguished Professor of Medicine and Director of the Center for the Study of Latino Health and Culture within the Division of General Internal Medicine, part of the David Geffen School of Medicine at UCLA. So I'll be talking about the difficulties we are going to have using the current race-ethnic categories as predictors for health outcomes in America's population that is becoming increasingly racially ambiguous. Babies have now mothers and fathers of different race-ethnic groups. Latinos, 75% of Latinos refuse to describe themselves by the race-ethnic group. If we don't use race as a predictor, what should we be using? We need to create a new epistemology, completely apart from racial post holes, to describe human samenesses and differences that will allow anybody to be the same as somebody else in some areas and different in other areas. We need a much more flexible, fluid way to describe human samenesses and differences. If we continue to try to use race to understand differences in health outcomes in the country, and yet half the babies born are racially ambiguous, Latinos are racially ambiguous, millennials increasingly refuse to categorize themselves by race. If we simply withhold them from analysis, we have no internal validity for the observations we do have. We certainly have no external validity. How can we possibly talk about somebody else? We need to find a better way to describe human samenesses and differences. Our current 6 race ethnic categories is not going to work further into the 21st century.
David E. Hayes Bautista, PhD, is currently a Distinguished Professor of Medicine and Director of the Center for the Study of Latino Health and Culture at the David Geffen School of Medicine at UCLA. He graduated from UC Berkeley and completed his doctoral work in basic science at the University of California Medical Center, San Francisco. Dr. Hayes Bautista served on the faculty at the School of Public Health at UC Berkeley until 1987 when he took his current position at UCLA. Dr. Hayes Bautista research appears in a variety of medical journals, including Family Medicine, the American Journal of Public Health, Family Practice, Academic Medicine, and Salud Pública de México. Some of his published books include The Burden of Support, Young Latinos in an Aging Society, El Cinco de Mayo, An American Tradition, and La Nueva California, Latinos from Pioneers to Post-Millennials. His most recent book is The Latino Big Bang in California, The Diary of Justo Vidia. Dr. Hayes Bautista writes columns for the Los Angeles Times and La Opinión, and is often asked to provide opinions on both radio and television in both English and Spanish. In 2012, he received the Association of American Medical Colleges Herbert W. Nickens Award for his lifelong concerns about the educational, societal, and healthcare needs of underrepresented groups. In 2016, in 2016, the Otli Award from the Mexican government. And with that, I'd like to introduce Dr. Hayes Bautista.
All right. So I want to chat about how do we do research going forward into the 21st century. And I'm going to talk a lot about racial ambiguity. But let me just back up to where we have been. So there's this famous model, the Minority Health Disparity Model. I'm sure you're familiar with it. And it says African American, American Indian, Alaska Native, Asian, and Pacific Islander, and Hispanic citizens. Now, that's a lot of folks in this country. You're talking about 100 million folks. Okay. Suffer poorer health and higher rates of premature death than the majority population. By the way, I was taught this at UCSF in the 70s, the same model. The model hasn't changed much. And we continue to use it. The recently released Centers for Disease Control and Prevention, the CDC report, Health Disparities and Inequalities, demonstrates that African American, Hispanic, Asian American, and American Indian and Alaska Native populations suffer higher mortality rates than other populations. So why is that? Well, the National Academies of Sciences, Engineering, and Medicine recently in their publication for metrics that matter for population health stated the primary drivers of poor health outcomes are race and poverty. And in fact, they defined race. So, does this work? I guess it does. Okay, so you start with the broad social, economic, cultural, and health, then the living and working conditions, social, family, community networks, individual behavior, And here are the innate individual characteristics, among them being race. You are born with a race. It is innate. It will determine a lot of your behavior, your things throughout your life, your health, and you will die with that race in this model. And then on top of that, we add risk factors, such as low income, low education, low access to care, and then on top of that, non-white race. So this is considered, why do minority groups have higher incidence of adverse health outcomes, higher mortality, shorter life expectancy, higher infant mortality, all of that. Well, I was originally trained as an engineer, so my first question is, well, let's look at the data. What do the data tell us? So here we have the death rates for the top 10 causes of death in the United States, starting with heart at an age-adjusted rate of 161.5 and cancer at 146.2. And those two causes of death account for almost 60% of all deaths in the United States. So clearly, we need to understand, why do we have differences? So let's take a look at the number one cause of death, which is heart diseases. And we're going to compare non-Hispanic white to Latino. Okay, so we compare the two. Between non-Hispanic white and Latino, which group has lower income, lower education, less access to care? Why Latino? And there's no arguing about that. Therefore, which group should have a higher age-adjusted death rate for heart disease? Well, according to the model, it should be Latino. But when we look at the data, that is not what we observe. The non-Hispanic white rate is 165.8 per 100,000. This is all age adjusted. Latino is 111.3. 30% lower. Now, this is not like a randomized clinical trial where if you get a 3 or 4% difference, you think, ooh, I got a better medication. 30%, multiple standard deviations apart. And we've been doing this by state. So here we have the states by alphabet with large Latino populations. And you notice while there's some minor regional variation in every state, we see that the Latino age-adjusted death rate for heart disease is significantly lower than white. So these would be states that have Puerto Ricans, Cubans, Dominicans, Colombians, Mexicans, Salvadorans. But we see the same pattern over and over and over again. So Los Angeles Metro is largely Mexican and Central American. New York's largely Puerto Rican and Dominican. Miami's largely Cuban, Colombian. We saw the same pattern. Well, let's look at the number two cause of death, which is cancer. Comparing non-Hispanic white to Latino. Which group has lower income, lower education, less access to care? Latino. So which group should have a higher cancer death rate? Well, not Latino. Non-Hispanic white, 151.4. Latinos, 105.6. These are very stable. We have now data going back to 1980 on these. Again, we look across the country, state by state, we see the same pattern with but minor regional variation. The Latino death rate for the number two cause of death, about 30% lower than white. So in fact, as we look at the top 5 causes of death in 2019, heart disease, cancer, unintentional injuries, chronic lower respiratory, and stroke, the Latino rate is consistently lower, anywhere from 15% to 60% lower. And as we look again by state, well, all causes, okay, which group has higher risk factors? Latino. So which group should have a higher overall death rate? Well, we've already accounted for heart and cancer, that's about 60%. So it should be a no-brainer that the Latino overall all-causes of death rate is lower, and it's about 30% lower than white. And again, breaking it down by state, we see the same pattern, this minor regional variation. Okay, well, let's get to life expectancy. So again, non-Hispanic white, Latino, Latinos with lower income, lower education, less access to care. By the standard model should have a shorter life expectancy, but in fact has a 3-year longer life expectancy at birth. And in fact, when we do our state-by-state breakdown, we see almost the same pattern, with one exception, New Mexico. Latinos only live as long as whites. Now, from the expectation, oh, they live as long as whites. What's wrong with folks in New Mexico? Don't know. We just, we see the patterns. So this is the Latino epidemiological paradox. I've been working on it since 1985. For 30 years, I've been told 20 ways to Sunday why these are not real observations. It's a fluke of the data. People go back to Mexico to die. I've heard every single possible hypothesis, and yet we still continue to see it. So we go back to this minority health disparity model. African American, American Indian, Alaska Native, Asian, and Pacific Islander, and Hispanic citizens suffer poorer health and higher rates of premature death than the majority population. Where did that come from? By the way, I noticed these sheets of paper over here talking about theoretical models founded on empirical data that explains relationships between phenomena. Can we see the data? And it turns out, unfortunately, this model does not explain Latino health. But we still use it, by the way. So I want to raise the issue of racial categories. Because I've had people come up to me and try to explain away, well, why would Latinos have lower death rates? So let's talk about racial narratives. And by the way, again, going over to here, remember, this is supposed to be based on empirical data. There are racial narratives in this country that, in fact, have become baked into the health sciences research. And I'll call them out simply that, narratives. People make suppositions because this model seems to fit a certain way of looking at the world. And it's a narrative. For me, particularly, that what we observe is not what we predicted. In fact, there's a huge difference between the predicted and the observed. We have a problem with the theoretical model. A theoretical model has to have predictive power. So let's take a look at race as we knew it and loved it. So here are births in California. Now, when the data are expressed like this, we've got the Latino births, white, Asian, African American, Pacific Islander, Native American, it reinforces the assumption, first of all, that race is a naturally occurring category, and we as researchers simply observe the race of someone and record it. That's it. It's naturally occurring. It's out there. We simply observe, record. Secondly, it assumes that these racial categories are mutually exclusive. No Latino is ever white, no white is ever Asian, no Asian is ever African American. Thirdly, it seems to assume somehow there's some internal uniformity, that all Latinos are alike in some way that makes them not white, and all whites are alike in some way that makes them not Asian, and all Asians are alike in some way that makes them not African. And it also reinforces the notion that race is something that you were born with, it's permanent, it's unchangeable, you will die with it. Well, let's take a look. One of the things that I was taught as a young engineer is the unit of analysis. What are we looking at? What are we trying to measure? So as we look at variables, we know what the unit of analysis, for example, education. It could be continuous, years of education. It could be dichotomous, high school grad, not a high school. You can cut and slice it. But it has to do primarily with how long were you in school? Months, semesters, years, but we can measure it. Okay. Household income. Well, the unit of analysis is dollars per hour, per week, per month, per year, but we can measure it. And we all agree this is what we're measuring. Even occupation, unskilled, semi-skilled, skilled, the census has all the definitions of occupations as well as industries. So we know what we're talking about. But then, we just as casually, in this analysis, throw in race. So we're looking at the effects of parental education and race on children's health. So we have education, then race, Black, Hispanic, Asian. So I'm asking, so what's the unit of analysis? What distinguishes a Black from a Hispanic, from an Asian, from a white? What's the unit of analysis? And I've been mulling that question now for about 40 years. How do we operationalize these categories and why? And what are we capturing when we do that? So I first want to take on the question, what makes a non-Hispanic person either white or black? Well, as we look at the census, there are instructions to the enumerator. From 1790 to 1970, the enumerator went out with these instructions. This is from the 1930 census. A person of mixed white and Negro blood was to be returned as Negro no matter how small the percentage of Negro blood. That gets it to the famous one-drop rule. Okay, simple engineer me, silly. So what's the difference between white blood and black blood? Okay, and if there is a difference, by the way, did you draw samples? Did you have lab results? No, they didn't draw blood samples in 1930. So how did they know who was white and who was black? Well, they operationalized it by the enumerator looked at the person and made that decision, who was white, who was black. That's science? Or is it simply operationalizing the local racial narrative that says this person is white, that person is black, you go to some other part of our country, it's done differently. Now, in the 1980 census, they stopped doing that. They took the burden away from the enumerator, and they asked the respondent, what race are you? So it's now self-defined. And in the 2020 census, nearly 95% of non-Hispanics were able to categorize themselves in one of the racial categories. Basically, white folks said they're white, black folks said they're black, and Indians said they're Indians, Asians said they're Asians, Pacific Islanders said they were. Very few were some other race, and not many said, well, actually, I'm two or more of those. Very, very few. I guess they got to learn the drill. So the question then, so what race are Latinos? Well, prior to 1980, the enumerator went out and had to define who was a Latino, actually a Mexican in the 1930 census. And we're told, here's how you do it. Practically all Mexican laborers, look at the class assumptions built in, practically all Mexican laborers are of a racial mixture difficult to classify, though usually well recognized in the localities where they are found. Okay, so imagine this. I'm the census enumerator, 1930 census. I'm here in South Texas, and I'm checking people off, and I see somebody way over in that orchard. But I can't quite make out what race he is. So I go to my friend Billy Bob Science. I say, Billy Bob, is that a Mexican? And Billy Bob said, yep, him's a Mexican. Okay, yes, we have a Mexican in the census. That's how they got into the census. I do ask, was that really science? Or was it, again, operationalizing the local racial narrative? And in the 2020 census, 3/4 of Latinos could not identify themselves into one of the US racial categories. About 20% said they were white. And we have to be careful. I think this gets misinterpreted. When Latinos say they're white, they don't necessarily mean white in the way that the Aryan Brotherhood would mean it, or the Ku Klux Klan. It could mean, I'm a US citizen, I must be white. I'm middle class. They mean a lot of different things, not necessarily they're trying not to be Mexican. And if they're older, they remember when they were told you were white, even though you couldn't buy a house, but you were white. So 20% said they were white, 1% they were black, 0.5% Asian, 2.5% Indian. 74.9% said, I don't understand this question. I don't see myself in these races. I must be some other race. So as we do our analyses and we're using race as a variable, we do have to understand that sometimes Latinos don't respond to the race question. So here we have, again, white non-Hispanic, black non-Hispanic, Asian non-Hispanic, then Hispanic regardless of race. Now wait a minute. I thought race was so important that one drop of non-white blood made you not white. Yep, we have laws against it. The Virginia Preservation of Marital Purity, Miscegenation laws, et cetera, et cetera. And then suddenly here's a group of 62 million people and race is not important? Oh, that's different. Well, wait a minute. And you will have seen this little note on the bottom of many, many tables from CDC. NB, persons of Hispanic origin may be of any race. So here we have what? Non-Hispanic white, non-Hispanic black, then Hispanic or Latino. Well, wait a minute. Is it important or is it not important? If it's important, everybody should have a race and we should be able to tell in some objective measure what their race is. Or it's not important. But how can you say halfway it is and halfway it isn't? For me, that is not good science. Well, some people say we don't need to measure race. Let's just use income and education as proxy measures for race. Okay, let's try this out. So in California, less than high school, nearly 40%, this is Latinas giving birth, didn't graduate from high school. About 8 times higher than white, close to about 4 times higher than black. Uninsured, over a third of Latinas were not insured, about 3 times as high as white, about twice as high as black. Living in poverty, about twice as high as white, fairly equivalent to black. So clearly Latinas, low income, low education, living in poverty, high poverty. So could we just say we're not going to ask Latino, let's just measure income, education, access to care? Well, it turns out at an individual level, these factors, income, education, have virtually no predictive power for Latino outcomes. For example, here, birth weight. So let's take a look. Poverty as a predictor for low birth weight. So each dot here represents a year's worth of data. The blue dots are white. And on the bottom is percent below poverty, about 10%. And on the y-axis is the percent low birth weight, about 6%. You notice these are really tightly grouped. I mean, it's hard to get much more tightly grouped than that. So then we look at, so let's add in African American. Now here, the poverty level is higher, ranging 20 to 50%, but fairly consistent at about 12% low birth weight. So you draw in your R-squared, and that's pretty tight. Seems like, oh, this explains a lot. We don't need to ask race. We just have to ask income and education, access to care. Well, wait, this is just poverty. Okay. But then we put in Latina. 30% poverty, 6% low birth weight, and there is no predictive power. Okay, so let's look at education. Similarly, here's why, wow, that is a tight grouping. You almost never see anything that tight. Black, fairly tight around 12%, and relatively tight around 10% not finished high school. Then Latina. Well, okay, we've got a nice tight line there, but we put in Latina, and again, falls apart. So you can't use income, education, or access to care as a proxy for whatever race Latinos are, because it also doesn't hold out. So the question is, so what the heck race are Latinos? Okay, the 2020 census, remember it asked everyone, first your ethnicity and then your race. So here's, first of all, your ethnicity, and there's only one ethnicity, by the way. You're either Hispanic or you're not. Sorry, Italian Americans, not an ethnicity. Sorry, my Irish friends, not an ethnicity. Sorry, my Jewish friends, not an ethnicity. It's only one, according to the census. Maybe we should argue with the census. Okay. Are you Hispanic or not? And it's a pretty loose thing, but there are those, in fact, in the 2020 census, 62.1 million, who said, of course I'm Hispanic. And we've done work on this. There's some of our focus group. When the question was asked for my ethnicity, if I was Hispanic or not, That was a simple response for me to select without an issue. Of course I am. Of course I'm Hispanic. Even though I don't speak Spanish, but I'm Hispanic. Even though I don't have a Spanish surname, but I'm Hispanic. Even though I was born in the US, I'm not an immigrant, but I'm Hispanic. Even though I have light skin, blonde hair, blue eyes, but I'm Hispanic. I have dark skin, curly hair, I'm Hispanic. And I don't like jalapenos, but I'm Hispanic. Oh yeah, we get a lot of the list can go on, but they're Hispanic. That's not a problem. But then Latinos are asked, oh now, what race are you? And let's take a look at what goes through Latino minds when they're asked what race they are. In my personal experience, my race is the most difficult for me to answer and pinpoint because I can never identify to any race. White, black, Asian, Native American. For example, in the census, we often found ourselves going through the options and reflecting on which race we could relate to the most. Are we more like African Americans, Native Indigenous, whites, others? This was an anguishing question for Latinos. It's not simple. It's very anguishing, and they don't know how to respond. And they would even Google the census website to see, how do I respond? They will ask people, and they get different answers. It's very confusing. So that, in fact, rather than say I'm one of these races, many times when it was a written or fill in the blank form, I was able to just leave the race question blank and just select my ethnicity. Of course, we post-code them as other, but in their minds, I'm just simply, I don't know what this is, I am Hispanic. Even though I don't like jalapenos, I don't speak Spanish, but I am Hispanic. And then what about my kids? I had to register my son for middle school, and it asked his race and ethnicity. While I am Hispanic, my husband is not. So are they, my kids, Hispanic enough to fill in that bubble? So why are Latinos so confused about what race we are? Well, here we're seeing the collision of racial narratives. It all began back in October 11th, 1492. On October 11th, 1492, not one single Indian lived in the Western Hemisphere. Not one. Oh, you had a couple 100 million people, but they weren't Indians. They were Purepecha. They were Tzatzal. They were Chumash. But they weren't Indians. They didn't call themselves Indians. But then, the very next day, Columbus is lost, trying to find India by sailing west. He sees land. I'm sailing for the Indias, I see land. This must be India. And so when folks came out to say hi, well, if this is India, then you guys are Indians, and we have been having confusion ever since. So clearly, as we look at Latinos, there is an indigenous base. But with Columbus, with Cortez, we're Africans. Some came as conquistadores, some came as slaves. They made their lives throughout the Americas during the time of the viceroyalties. You even had black religious groups, you had black military groups, all over the country, all over the hemisphere. In 2015, the Mexican census decided to do a special census to look at the we call them African American population. And the question was, what question do we ask? Are you prieto? Black could mean I'm black, it could mean a lot of other things. Negro, moreno, there are a lot of different ways. Well, the way the Mexican census finally did it is they operationalized it as, are you afrodescendiente? Large black root in Peru, just as another example. Oh, Argentina. Are there any Argentines in the room? No, no good, we can tell Argentine jokes. Well, one of them, and it's not a joke, Argentina likes to hold itself apart from the rest of Latin America, and they often say, somos un pedazo de Europa in America Latina. We are just a piece of Europe, happen to be living in Latin America, like as if they weren't racially ambiguous like the rest. But yes, I've seen the census data. The census of 1825 of Buenos Aires, a fourth of the population would be called, in Mexican terms, afrodescendientes. And they didn't move away. They didn't go away. In fact, they gave us the tango. You also had Asian populations. Beginning in 1565, the treasure fleet would sail from Acapulco over to Manila. They trade with people from China, Japan, Korea, Southeast Asia, India, and then come back. And when they came back, they would bring people like the famous China Poblana in Puebla, the figure, the folkloric figure for Puebla, for women, called her a Chinese from Puebla. She actually wasn't from China. She was from Rajasthan, in today's Pakistan. But you get the sense of, and for 300 or 250 years, this constant input of people from all over Asia. And you also had Iberians and Europeans. And the Iberians brought a couple of special qualities with them. One was that in 1492, the year that Columbus discovered America, King Ferdinand and Queen Isabel kicked all the Jewish folks out of Spain. Many of them came across trying to escape the Inquisition, and you will find their descendants, particularly in New Mexico, very strong Sephardic presence in Mexico. And King Ferdinand and Queen Isabel were so happy with the results of kicking all the Jewish folks out that 20 years later they kicked all the Muslims out. And many of them came across here. So here in the Americas, people from indigenous Asia, Africa, Iberia met, formed families, had kids. So the Spanish colonial system attempted to categorize the different groupings by race so that the offspring of a Spanish and an Indian, can you barely see a yellow letter, the Español e India, the child was a mestiza. Or between a Negro and an Español child of an African and a Spanish would produce a mulatto. And if a mulatto and a mestizo had a kid, you had categories for that. Add in folks from Asia, and it starts to get really complicated. There are about 40 different categories that the Spanish crown tried to use. Basically, it was pretty unsuccessful outside of Mexico City. So that when people ask me, so you're Latino, yeah, so what race are you? I say, well, proudly, I am Indo, Afro, Oriento, Ibero, Americano. Yeah, kind of all of the above, which I am. Most Latinos are. In fact, when we look at the 1,000 Genomes Project that's been going around Latin America, here are some inputs, Native American, West African, and European, and 3 samples. In Medellin, Colombia, Los Angeles, and Puerto Ricans and Puerto Rico. And the way you read it for each column, the red is European input, blue is West African, yellow is Native American. So in Colombia, basically everybody has some European, just about everybody has some African, just about everybody's got some indigenous. In Puerto Rico, basically everybody's got some European, everybody's got some African, and everybody's got some indigenous. And Mexican Americans in El, basically everybody's got some European, everybody's got some African, everybody's got some indigenous. Somewhat different proportions, but all of the above, which is why I use my term. A little bit unwieldy, but if they want a race, there it is. So this is just a 16-way table during the colonial period. They're up to about 40 different categories. And of course, away from Mexico City, like up here in Texas or in California or in Nuevo Mexico, these categories really fell to pieces. So that's why it's difficult for Latinos to pick a race. I mean, there's 500 years of history there. I mean, what, do I just pick one of all of my ancestry or what? Now let's move forward to the babies being born. These are in California, but you'll see something similar. Okay, remember, we like to categorize people by race, so here are the births. And actually the way they do this is, you notice, these are babies categorized by the mother's race and ethnicity. So this is actually not the ethnicity of the baby, it's the ethnicity of the mom that gave birth to that baby. So we tend to think, well, that's the race of the baby. The race of the mother is the race of the baby. But what about the fathers? Well, the birth record in California gives us almost no data about the father. So we reconstructed the household using census data. And we looked at households that would have a 1-year-old or younger child. Then we'd look at the mothers and fathers who were in that household. And what we saw was a little bit interesting, that the way this reads, like non-Hispanic whites in the yellow portion, had the father of their child was also non-Hispanic white, but the darker portion was the father was not white, something else. Latinas, African Americans, Asian Pacific Islanders. So you notice a good percent of the moms had a father of a different single race group. In fact, over half, 52.6% of the babies born in between 2011 and 2015 had mothers and fathers of different single race groups. In 47%, they were the same. That is, the mom and the dad were of the same single race group. What this came down to is 25%, just de plano, white mom, black dad, Asian mom, Latino dad, or whatever. And then in 16% of the case, one of the partners was some other race, which means what race, again, is the baby? It's not clear. They're not of the same single race group. In 8%, there was no race information. So we can't compute. And this is typical. US is about the same. And 3.5% were intentionally two or more races, which you get a lot of. So if we're going to predict birth weight, it's going to be difficult as we use race, because in less than half were the races congruent. And in the olden days, when you had stuff that didn't fit, you could say, well, just withhold these from analysis. How can you withhold the majority of the events and hope to have any internal consistency at all? Well, you can't. What do we do? And millennials, increasingly when they're asked the race question, refuse to answer the way people expect they should. They'll say, I'm human, I'm purple, all sorts of things. But they're not playing that race game either. So you can imagine, well, wait a minute, we've used race for 250 years in this country to predict outcomes. But what happens when you can't do that? When a good chunk of the population simply says in various ways, I'm not playing that game. What do we do? Remembering, as recently as 2016, Institutes of Medicine, the primary drivers of poor health outcomes are race and poverty. So what do we do? Well, for Latinos, remember, we're kind of all of the above, and we don't even know, are we Latinos, are we Hispanic, Latinx, Chicano, Boricua? We can't agree on what name to call ourselves. Does that mean there's nothing there? If we looked at outcomes, health outcomes, there would just be random plots. But we don't see random plots. In fact, there's a group, and I work with them, this letter about NIH must confront the use of race in science. And the key part of this letter, in these troubled times, a clear statement regarding use and misuse of population identifiers in the pursuit of characterizing human difference could help alleviate ongoing and widespread confusion on such matters. So NIH, by the way, some of you may have read what they came out with about 6 months ago, and it's still confusing, basically, still confusing. And if we stop using it, okay, we talked about the Latino health advantage, but then notice how the blacks have higher heart disease and cancer rates, although lower unintentional injuries and a lower chronic respiratory. But clearly, we don't just get random variation. There's something going on, even though race as a scientific construct, I think, shouldn't be applied, but something is going on. We're picking something up, but it's something that right now we haven't yet conceptualized. But we can see really strong patterns, really strong. Well, what makes someone Latino? And we tend to use in our, well, do they speak Spanish? They're Latino. They have a Spanish surname, they're Latino. But there are strong patterns that seem to fly in the face of convention. So here's where my thinking is right now, that these things that we have used as if they were causal variables, like ethnicity, speaking Spanish, race, Spanish surname, birthplace, Spanish origin, actually are only proxy measures, proxy variables for something bigger and deeper. Because these variables alone, even though they can be used and often are used, particularly in regression analysis, as if they were causal, are picking up something, but they're very incomplete in and of themselves. When it comes to Latino, I often say there are 62.1 million Latinos in the United States. Ask them to raise their hand and describe who they are. There are 62.1 million ways of being Latino. And no two Latinos are Latino in exactly the same way. Even if they're siblings, raised in the same household with the same parents, they will be different. They'll have different experiences. And yet, they have no trouble raising their hand and saying, yes, I am, but I'm different from my siblings. That is what we need to capture. Not these other, they're proxy measures at best. They're pointing us to something bigger that yet is beyond our ability to conceptualize. So in short, and to summarize, what we need to work towards is a new epistemology to describe human samenesses and differences. But it'll have to a way that is extremely fluid, that would allow everybody in this room in some fashion to be the same, and in different fashion to be 20 different ways, 30 different ways. We have to think differently, more fluidly. One that is based on the way people see themselves, the way they see the world. It's going to be very different. And the DNA is not the answer. But one thing that's really important, which is why we're all here, I don't want a bunch of white guys back in Washington trying to tell us what to do. They've been doing that long enough. We need to get the subaltern voices of subaltern racial narratives into the research laboratories. How do African Americans talk about race? How do Asians talk about race? How do Latinos talk about race? How do Native Americans talk? We all talk about it. It's not that we don't talk, we're not aware of it, but we talk about it differently. That needs to be part of the process of generating theoretical models. We're missing it right now. So we're having basically the dominant non-Hispanic white racial narrative baked into the models. We're trying to measure assimilation and all this other stuff. We need your voices in those research laboratories to help us figure out what is that new epistemology. So I don't have an answer, but I hope I've helped us think about the problem, and I invite you to join me and my crew. We're trying to figure this out. And I think we need to find it by the 2030 census, or you're going to get so many non-responses on race, it's going to be impossible to use race as we knew and loved it as a predictor variable. Just impossible. There won't be too many people not playing the game. The census is way behind where our populations are. They're right here in this room. So, as in Mission Impossible, this is your mission. Develop a new epistemology to describe human samenesses and differences fluidly, continuously, and predictably. So with that, I'll turn it back to you, Ariel.
That was outstanding, and you're welcome to, let's see how much time we have.
Questions?
Can we just give him like another big round of applause? That was really great. Thank you so much. We have time for some questions and answers.
Or thoughts. Doesn't
or
have to be a question. Thoughts, reactions, feelings. That's all good.
All of those.
It's all legitimate.
I will, if you raise your hand, I'm happy to come around with the mic. And then after a few minutes of Q&A, we'll go back upstairs for the reception. So.
And feelings. Please express your feelings about this.
Thanks so much for this very enlightening talk. I guess I have two questions. One is whether or not it'd be really practical to be able to capture something, whatever the latent construct is that Hispanic identity is, in a census with just a few questions. I mean, you could ask a whole battery of questions, but there's just not enough time on the census to do that, I guess. And the other is what your thoughts are about self-identification. I think there have been news reports of people who have, for example, no background or family history with the African American community, just identifying as being being Black, for example. What your thoughts about that might be?
Definitely, that needs to be part of it, because we have had bureaucrats in Washington deciding on their own what the races are and how. Read the instructions to the enumerator from the 1790 census to the 1980. Of course, now it's all up to you define yourself. But in the birth records, we do different things. I mean, one example: what race was President Obama? The answer is it depended when and where he was born. In the 1960 census, the instructions to the enumerator, they knocked on the door and the door opened up and it was a racially mixed household. The instructions to the enumerator were to bridge the race of whichever adult answered the door to all the children. So if Obama's father had answered the door, he would be Black. If his mother had answered the door, he would be white. 1970 census. They decide that's not good enough. We're going to bridge the race of the father to all the children. So then Obama becomes Black. 1980 census, we changed. No. Now we're going to bridge the race of the mother to the children. Now he's white. So actually, Obama is white. No, but he was born in 61, right in between. So, but there's a case of the racial ambiguity in terms of how we are told to determine race. 3 different ways. And Obama could be black or white or black or white or black or white, depending on when or where he was asked. And I'm thinking, and this is science? But I guess it is. We think so. We need a better epistemology that can capture all of that. Even though, if he had been born in 1980, he would have been white, clearly he experienced life in Southside Chicago, clearly. And in Hawaii. I mean, it's just, how do we capture a person's entire lived experience, the Indo-Afro-Oriento-Ibero, into our data systems? We just got to think differently. Because we've been so used to these race ethnic post holes, we assume everybody's got to fall into them. The funny thing is, when I share these sorts of findings, I get some senior investigators here in this country. Oh, gee, this is wonderful. Let's go to Europe and see how they do this. They don't do it. No, we're about the only country left that asks race ethnicity. Nobody else asks it. How can they not ask it? See, it's assumed it's a naturally occurring phenomenon. We as researchers simply observe and record, not around the world. It's not that there aren't differences, but they're not based on that. There are other ways that people distinguish themselves. So for me, it's a process. We just need to get your voices into those research laboratories, help you develop your voice so that you're willing to raise your hand and say, wait a minute, let's go back to the data. Maybe we need to get these other racial narratives, these subaltern racial narratives here, and let's start duking it out. But right now, they've been absent from the 1790 census to the 2020. Long answer to short question. Questions, thoughts, feelings, reactions. You did your 2 questions. Now he gets a chance. You can ask me at the thing. We got to spread the mic around. You can ask me over a drink tonight.
Thanks for the excellent presentation. I'm just trying to figure out exactly, if you can give me an example of what kind of a narrative a Mexican American or a Mexican will have about these issues that you're trying to capture. You know, I'm trying to understand how we will voice that experience or that narrative about race that you're trying to capture.
Well, that different parts of the world speak about it differently. In Mexico, you got a lot of different races. You got indigenous, you got afrodescendientes, you got Asian, and people are aware of this in their family. One of the differences in the way that it's spoken about in Mexico and in most of Latin America, there is a colorism in Mexico, there's no question about it. But the difference is in the experience. In this country, up until I was a junior in college, these racial categories have the force of the law behind them. You had to use them. Because of these racial categories, You could buy a house here, but you can't buy a house there. You could marry this person, but you couldn't marry that person. And in many states, it was obligatory, mandatory. You had to segregate. Almost all the Latin American countries, when they became independent from Spain, got rid of the castas. They no longer had the power of the state. Now, there are individual prejudices, but they're individual prejudices, not the power of the state. And we need to work on the colorism, but it's different when you didn't have the power of the state enforcing it. So that makes a big distinction between the Latin American experience of race and the North American. And you get folks, they finally did, by the way, also in 2015, besides the Afrodescendiente census, they did a special census on indigenous. And how do you define indigenous when about 80% of Mexico says, oh yeah, I've got Indian ancestry? So they had their own, they tied it around language. Did you speak an indigenous language? Or live in a household that had an indigenous language spoke? But indigeneity, there's the Zapotec poet and artist, very big. He wrote it in Zapotec. He did his 23andMe about 2 years before he died, discovered he's also African. So, oh, I'm indigenous and African. But that part was not in the family stories. I mean, it's very complicated, no question about it. But you do get different narratives about it. You know, I go down to Charles Drew University and we talk about race. And African Americans will talk about race differently from the way white people. It's not that they would ignore white folks in that, but in their own families, they'll talk about the wonderful mosaics that they come from. But that's often not captured because they're going just for the one drop of black blood in the forms. I don't have a quick answer, but I have a process answer. We need groups like folks like you all talking about this with the idea of developing a completely different epistemology that gets us out of these race ethnic post holes. That's my goal. Think we can do it tonight over a couple of beers? Who knows? Let's try it. Let's try it. Okay, there you go. There you go. Great thoughts. Reactions. Oh, okay, do you want to? I think you need the mic so that it can feed into the.
So my question is, can we use some of the data that exists to make these distinctions, the samenesses and differences, and what are examples of those, and what does need to be collected? What's new that needs to be collected?
Well, you notice I use the data organized by the categories that I'm arguing against, but for me the race is not determinant, it's not causative. It's a proxy measure for something else that I can't yet conceptualize, but I can see in the outcomes very clear, very consistent differences. The whole epidemiological paradox, and no one's been able to explain it away. Some people, oh, they go to Mexico to die. Well, not if you're born here, and 2/3 of Latinos are born here, so they're not going to Mexico to die. You're still seeing the same patterns. So there's something bigger out there, and it has to do with narrative, it has to do with history, it has to do with community. I can tell you that much. And family. So something that pulls all of that together in a way that people can respond to in less than a 35-minute respondent burden. How do we do that? And if not, we continue using the race ethnicity and an increasingly racially ambiguous population, we're not going to be able to predict anything. Feelings. What are you feeling right now? Me? Yeah. This is, the American racial narrative. You say you ran across it in Minnesota.
I think I was looking at it because you're talking about, Latinos and you also mentioned the African part of it. And you're talking about the differences or like how their children or, populations that are going to have more than one. And I was just trying to understand or think about it in the other way. Like, what of other, people, nationalities or races that have, let's say, African and something? Like, how would they, let's say in the census, how do they answer that question in terms of race? Like, do they say other? And I think this is what I struggle with too when I'm asked that question. When they're like, are you black or African American? Do I say yes or do I say other? So when you were saying that, I was just thinking about it in an African perspective. And
Precisely.
yeah.
And that African perspective needs to be joined to the African American experience because they're two different experiences, but they're here in this country today and they're affecting health outcomes.
Hayes Bautista. Just really appreciate the frustration it is to try and choose race when you identify as Latina. This is not really a question, but more of a thought.
Okay, good. Now we can start.
And I wonder the connection of health outcomes is not so much like genetic ancestry, but how people are racialized in societies. And I just wondered if you had any thoughts on that.
Yeah, I was in Houston yesterday. We were doing the U.S. Latino GDP at the Houston metropolitan level. And so I was pointing out, starting with the health, there was clearly a healthy Latino lifestyle. Because we see these same epidemiological paradox around the country. Wherever there's a Latino population, we see it. Some minor regional variation, but compared to the whites in that region, pretty much the same. And it's not tied to income, education, access to care. And clearly, race, what is that? But there's something there. Then we moved into the gross domestic product of Latinos in Houston. And again, we saw the same thing. Very high levels of labor force participation, primarily in the private sector, rarely in the public sector, low levels of welfare use, strong family ties, rising incomes, you name it. Rapidly rising educational levels wherever we go, whether we're in New York City or Miami or Illinois or in Houston, we see the same patterns. So it's not random variation. It's very strong. There's something there. And again, it probably has to do with including narrative, history, community, family. And how do we weave that? I don't know yet, but maybe that'll get us. But that's just the Latino piece. What about the African American piece, where you can get the African and the African American? There's going to be a fascinating set of mosaics. American Indian, oh my God, so many different ways. Asian, I mean, this is so interesting. On the birth form, one of the racial categories is Vietnamese. When I was growing up, Vietnam didn't even exist. So suddenly it's a race, and it didn't exist when I was French Indochina. I mean, there were people there, but when I say, well, Vietnam is a political entity. By the way, you have about 12 major language groups in Vietnam, so which one is truly Vietnamese and the others aren't? But it's the way we want to make nice, nifty little things, but particularly when you look at the Asian way race is mapped onto Asian, it's national identity, really, which is different from race, ethnicity, etc. So this is complicated, but it's a reality. The racially ambiguous portion of the population is growing. In fact, if we looked at our own DNA, you notice even a lot of white folks aren't as white as they thought they were. Okay, little surprises. So we need to rethink the entire concept of how we categorize and describe human samenesses and differences. It's back to basic epistemology.
Are we ready for the second round?
Oh, okay.
I'm always surprised about, I want to use your experience with this topic. Going to the data and the scheme that you were presenting about, occupation, education, income, you would expect the Latinos would be the one with the worst outcomes, that you present all this data that is completely the opposite. In terms of building narratives, why it became the Hispanic paradox and not the white paradox? Why we don't wonder why, or what is happening with the non-Hispanic white, that given the occupation, the income, whatever, the mortality is higher than the rest of the population, because that also changed the optic about how you think about race, whatever we wanted to measure that. But I was always surprised that the narrative was really in that direction.
Because the norm, quote unquote, for almost anything is the non-Hispanic white population. And I keep arguing, or for Latinos, we're so many standard deviations away from that norm. We need to think of a Latino norm. And why is white so high? With all that advantage, with all that privilege, with all that access, why are their drug death rates just skyrocketing? What's wrong with that lifestyle that's yielding that? So that should be part of it, but we have been so used to norming everything to whites, because I remember when we look at how you operationalize things and how you interpret, again, it's back to theory, method, and data, the whole issue of family structure. So ever since the 1960s, the narrative has been the disappearance of the black family. There's so many single moms, and that's going to lead to this and that, the other, juvenile delinquency, poverty, et cetera, et cetera. So they say the problem with Is there not enough black family? Then they turn to Latinos. Too much family. It holds you back, blah, 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 blah. So what is the correct amount of family? Look to Boston. Just, what we have, that's the right amount. This is not science, okay? It is narrative, but it gets baked into our theoretical models. The fact that we would use white as always the reference group, part of the baking into the model. The theoretical models, be it the assimilating immigrant, urban underclass, the traditional society versus modern society, you can take any of those down by just looking at how do they operationalize it. For example, when they were doing all the stuff on this is big in the 50s and 60s, 70s, the anthropological stuff, that Latinos had a traditional society and whites had the modern society. So among other things, we didn't have as Latinos a future time orientation. So the mañana sort of attitude, whereas Anglos had good future time orientation. How did they operationalize that? Do you have a savings account? Well, Latinos tend to be underbanked. For a lot of reasons, Latinos don't put their money in a bank. But it was operationalized. That makes you not present or not future oriented. You don't have a bank account. You guys have a bank account, so you're future oriented. So you operationalize these variables differently, and I can prove, quote unquote, that Anglos are traditional and Latinos are modern. What it also proves to me is that this whole approach probably doesn't hold a bunch of water if you can just switch the operationalizations around. But because white has always been the norm, that dominant racial narrative, we just sort of assume, yeah, that's the normal. How are we all different? And usually the difference is bad. Not enough family, too much family. How can you win for losing?
So maybe this is more of a thought, but as you think about people's narratives around their race, how do you deal with people that may not know their history or may not have people to ask, or people the generation before don't know? So how do you construct those narratives? I could think of a lot of people that may have the ability to research, and genetic testing's built on the people that provide testing, right? Mm-hmm. So that's limited too, but it seems like there would be generational differences potentially, but also what knowledge base is available.
There could well be. I mean, these things were not often recorded until relatively recent, the past couple of 100 years. So that sometimes is part of the narrative is, I don't know. We can go back to my grandparents, and after that, I don't know. I see this, for example, in the Latino population, particularly amongst the Chicano, who tended to be third generation. Their grandparents left Mexico during the Mexican Revolution, because they know they're from Mexico, but then I ask them, so what state? I don't know. What city? I don't know, somewhere. Or else they'll say, Guadalajara, and everybody's from Guadalajara, right? But they don't. But that's part of their narrative. They don't know, and I hope I spark the interest. Well, go talk and find out. You can find out, maybe, but that is part of the narrative. Things do get cut off. Records get burnt. People get shipped across the ocean without those records. There could be a lot of reasons why, but that's part of their narrative. But it also means narratives are flexible, plastic. You can find something out, get some little pieces, bit by bit. Not everybody has that knowledge. You're absolutely right. Which can become part of their personal narrative. I don't have that knowledge. But they ought not be shamed for it. Just, okay, that's their narrative. We all bring a different history into this. Personal, family, community, larger society. Good thought, though. We'll have a beer over that one. Oh, there's one in the back.
I'm going to probably say something that's probably very controversial here.
Oh, in this room? Oh, gee, what a surprise.
So if it's representing something, and I'm really glad you pointed that out, as imperfect, as controversial as these categories are, they seem to be working in some way. If that's the case, why are we fixing it
Oh.
or trying to fix it?
Well, now this is my interpretation. We have considered race to be a causal category for centuries. Because you're this race, you're going to be less intelligent. And some people still think that to this day. Okay. But as a causal category, I hope I've kind of shed some shade on that. That is particularly when you get a racially ambiguous population. How can you say this race caused that outcome when the baby's got a lot of different ancestry? But I did not sign on to that letter that said, so stop asking the race question. Imperfect as it is, right now it's allowing us to, for me, race is a proxy measure. It's not causal, it's proxy. But that often, people don't always hear that or understand what I mean. I'm using it because, like I already use income, education, or Spanish speaking or Spanish learning, they're all proxy for something much bigger. So for me, it's a proxy, it's a crutch. I will use it until I can get something better, and once I get something better, I'd hope to discard it. But we need to understand there are differences, there are inequalities, and we can't lose sight of them either.
I totally agree with that. And I think maybe it's not about how to reshape the race, how to make it more like science or genetically race ethnicity, but as researchers, we can talk to people about this. This is really not race genetically or biologically. It's a collection of your history, your experience, and everything. It's a proxy. Maybe that's our responsibility rather than trying to fix,
I'll have a tequila with you over that. I mean, you talk to people in the genomics field, and it's clinal. If you say, well, this is going to be white, this is black, it's clinal in between these two. And wherever you put the point, say, well, from here to there is one race and there to there is a different, that's totally arbitrary. So, and you notice in genomics, they stopped talking about racial origins, now geographic. Oh, your DNA had origins in this part of the globe, but it didn't mean you're racially what we think of that part of the globe. So it's messy, complex, but the whole point is we need your voices with your personal experiences, your community experiences, your larger societal racial narratives in the research lab to have these conversations. Bring your little grain of sand, your granito de arena, and add it to the conversation. That is imperative. So I've got a tequila, a beer, and a beer. Oh boy, this is going to be a long night.
It's going to be a lot, yes. I'm doing a time check. Yeah. So we have time for maybe one more
Comment. Thought, yes. Doesn't have to be a question. Feeling, a feeling is okay too.
So as we were talking about, actually it was, I think my reaction to this comment here about how race, if it's been working for some time, like why change it? I think I was talking earlier to Rogelio here about the framework in general. I think it's just due for an evolution. Because if you think about race as we use it, it's really supposed to represent something about the individual. But I think what you were mentioning, Christina, is very important to know that it's actually more of a socialized experience, right? So if I were living in a vacuum, would my race matter? It's different from education level or income, where it gives you access to something. It's like an asset in an environment where if I have more education, I have access to X resources, whether that's people or the financial assets, what have you, similar to income, right? That gains you access to something within the capitalistic society of the United States. But race is an interesting one because it's your relative experience when you're socialized in a group setting, in a community of some kind. And there has to be somebody else who also recognizes your race or how you're showing up in that space that is different from them. So it's a very interesting way of looking at it. It's different. It's a different framework that it operates from. So I would just argue that, like, while yes, it has been working within the framework that we've been conducting research, I think in general the framework is a little bit questionable to begin with. And yeah, anyway, that's just a happy thought.
Yeah, yeah.
But even within that, what race are Latinos? Okay? And if Latinos can be any race, and yet we see these very distinct, very robust differences in health outcomes, then clearly we're looking at something other than race as it was conceptualized back in 1790, which some people still use, that same 230-year-old conceptualization. There's something bigger. And it goes on beyond income, on beyond education, on beyond access to care. What is it? And I don't know. But I'm curious, and I won't give up till I find out something. Join me. I don't know. The research world needs us to figure this one out.
Thank you very, very much for your time. Thank you all for joining us this evening.